thank you very much for joining us today. Can I just kick off by asking that, given the state the NHS is in, it's crumbling under the Conservative government, if the Tories win in 2020, do you think the NHS will be recognisable after that election?
I genuinely don't, and I think you have to be very careful about scaremongering on the NHS. So I give that answer cautiously, but it's based on the experience that we have had in North West London of the biggest hospital restructure, in other words, closure programme, there's ever been in the history of NHS. And that programme itself, although it hasn't succeeded so far, has been the basis for what are called the sustainability and transformation plans across the country, which we've seen just very recently are going to result in major downsizes and closing of hospitals, of services and of beds. So no, I think that there's a long-term programme of decline in the NHS, which is probably linked to bringing in private sector providers. But I can be as sure as I can be of anything that the NHS, if the Tories had it till 2025, would not resemble anything we know now.
We've got an ageing population with increasingly complicated needs. How can Labour develop a policy and a strategy to ensure we can keep the NHS free at the point of use and a policy that will win for the next election?
Well, there are some good ideas out there. They include the integration of social care and health services, which relieves things like, in the unfortunate terminology, bed blocking, which gets people more appropriate and actually more cost-effective levels of care, and about ensuring that both preventative care, community care and primary care, GPs particularly, are dealing with a lot of issues that currently go into hospital services. So none of those, is in any way actually controversial. They're very difficult to achieve, and they need a government that's committed to the NHS to do that. The problem is we also need continuing investment in acute care, and you cannot in any way diminish the level of acute care. In fact, it probably needs to go up in the short term until those other building blocks are in place. And that's the real problem. It's not necessarily the diagnosis of the problem that the government has got wrong, it's the execution of what they're actually doing.
So, housing is one of your briefs. You're a London MP. People in London need to be earning at least £100,000 to even think about getting on the housing ladder. How can Labour offer a viable housing policy to help get people on the housing ladder without encroaching on the green belt any further?
It's extraordinary in a way that the London housing market functions even as well as it does. It's a terribly dysfunctional thing for the reason you've given, and the problem is none of the three main constituent elements is working. So there's been an actual long-term decline in the number of social housing units owing to not just not building them but through sale and not being granted in planning consents. The private rented sector has gone up by default because the other two sectors have gone down, but the prices and the conditions are the worst really that we've seen for a very long time in terms of affordability but also conditions. And owner occupation, astonishingly really under a Tory government for which it should be a priority, it is a priority for us, is also going down. So you've got to deal with all of those issues, but there is a way of doing it. And the way of doing it is, firstly, you have to allow councils to borrow, you have to actually build social housing units, and you have to have schemes to allow access to home ownership. So that could be, for example, what the Mayor of London, Sadiq Khan's London Living Rent scheme is, which means that you're renting at only a certain proportion of your income, maximum a third, gives the opportunity to save up, it gives the opportunity after a period of years to buy into and then buy the property you're renting, or to save for a property elsewhere, as well as addressing the insecurity in the private rented sector by having longer term tenancies with rent controls within those tenancies. Now I've rushed through those answers, but you can see from that there is a real opportunity to do things, and we've just had a housing white paper that did nothing on any of those three areas of tenure.